Welcome to this PCNA peer-to-peer tutorial entitled The Aortic Valve, Healthy versus Unhealthy. Objectives for this program are for learners to be able to explain the normal anatomy and function of the aortic valve, to describe aortic stenosis, its causes and potential risk factors, and to list common symptoms associated with aortic stenosis. Upon completion of this tutorial, the learner will earn 0.25 CE contact hours. PCNA would like to thank Edwards Life Sciences for providing an unrestricted educational grant to help make this program possible. It's my pleasure to introduce our clinical expert today. Chloe Villavaso is an adult health clinical nurse specialist at the Tulane Heart and Vascular Institute in New Orleans, Louisiana, where she has been a leader in the development of the structural heart and transcatheter aortic valve replacement service. Chloe received her Master's of Science in Nursing from Louisiana State University Health Sciences Center. She is a member of the Preventive Cardiovascular Nurses Association's Board of Directors. Welcome, Chloe.
Thanks, Jane.
Could you please explain and help us lay the groundwork for this tutorial series by reviewing the basic anatomy and function of the aortic valve?
Absolutely. The aortic valve is located between the left ventricle and the aorta. The normal aortic valve consists of 3 semi-lunar leaflets, or also known as cusps. And during systole, the aortic valve opens to allow oxygenated blood to flow from the left ventricle into the aorta and then out to the body. During diastole, the aortic valve closes to allow for ventricular filling. In early life, the aortic valve is very thin and pliable. You can notice to the right of this slide, you can see what a normal aortic valve looks like, and then a closed aortic valve that is not allowing any backflow of blood.
So it seems that the aortic valve plays an important role in the normal cardiac function. Chloe, what happens when the valve doesn't work as it should?
The aortic valve is very important. As I mentioned, it allows oxygenated blood to be delivered to the entire body. When the aortic valve becomes stenotic or narrows, there's an increased resistance as blood is ejected from the left ventricle into the aorta. You can see to the right side of this picture here a comparison of a normal aortic valve and an abnormal or diseased aortic valve, where it's harder for this valve to open. And then you can see that the valve that's closed doesn't close properly. So often with patients that have aortic stenosis, they will also have aortic insufficiency, where the blood flows backwards back into the left ventricle. The causes of aortic stenosis: there are degenerative changes that play a part in the development of aortic stenosis, congenital abnormalities, and also rheumatic heart disease. In degenerative aortic stenosis, calcification forms in a process that's similar to atherosclerosis, that involves inflammation. So if you look at this picture, you can see that this valve is not thin, it's thickened, and it's not closing all the way. There's a higher occurrence of degenerative aortic stenosis with age, and this is the most common cause of aortic stenosis. 2 types of congenital abnormalities that are found with aortic stenosis are bicuspid valves and unicuspid valves. Bicuspid valves contain 2 leaflets or cusps, and we know that on average, individuals with a bicuspid valve develop aortic stenosis about 10 years before individuals with a tricuspid valve. On the right, the unicuspid valve, you'll notice the 3 leaflets are fused together. This is thought to be a rare form of a congenital abnormality, but it may not be as rare as we think because these valves are often thought to be bicuspid. Then aortic stenosis caused by rheumatic heart disease begins with an untreated group A streptococcal infection, like strep throat. Rheumatic fever develops, then inflammation causes rheumatic heart disease. Inflammation and scarring of the aortic valve are a result of rheumatic heart disease. Then the patient will develop aortic stenosis.
Chloe, are there risk factors for developing aortic stenosis that nurses should be aware of, risk factors similar to those that we know very well, people at risk for atherosclerotic cardiovascular disease?
Yes, Jane, I'm glad you asked about that. Risk factors found in patients that have aortic stenosis can be divided into non-modifiable risk factors and modifiable risk factors. So what we see with non-modifiable risk factors in these patients are patients over the age of 60, male sex, having a bicuspid aortic valve, history of rheumatic heart disease, and having an elevated lipoprotein (a). I put an asterisk next to lipoprotein (a) because this particular lipid particle is there's a genetic factor that plays a part in the level that a patient has. So while we don't have one particular drug or any particular drugs that target LPA, there's nothing at this point besides lowering the LDL that we can do to lower LPA. And I will say that there are medications that lower LPA, but we don't have any specific drugs that target just the LPA. There are some trials that are underway right now, so hopefully in the future we will have medications that can treat Lp(a) and reduce the risk of atherosclerosis and also aortic stenosis. Modifiable risk factors include hypertension, smoking, obesity, coronary artery disease, diabetes, elevated LDL-C, and metabolic syndrome.
So once we've identified that someone is potentially at risk for aortic stenosis based on these risk factors, what symptoms should nurses be looking for in their patients to identify this problem early on?
I like to use the acronym HAS. So H stands for heart failure. These patients often present with dyspnea, lower extremity edema, exercise intolerance, paroxysmal nocturnal dyspnea, and orthopnea. The reason that patients with aortic stenosis have these symptoms is because the heart is unable to meet the physiologic needs of the body due to the narrowed and stenotic valve. A is for angina. Patients with aortic stenosis often have coronary artery disease, so we will see some of the same symptoms in our CAD and aortic stenosis patients, including chest pressure, chest tightness, heaviness, squeezing sensation in the chest, burning, choking sensation, and a chest discomfort that radiates to other parts of the body, like the neck, jaw, shoulder, back, and abdomen. S for syncope. Patients with aortic stenosis can have syncope, and it's often associated with exercise. They may also experience dizziness and lightheadedness. It's important when taking a history that clinicians compare present activity level with past activity level. So for instance, when a patient comes in, they may say, oh no, I don't have shortness of breath. I don't have chest pain. But that could be because their degree of stenosis is so severe that they've stopped doing their normal activities which would cause symptoms. So they're more sedentary, they're not doing much. It's important to ask questions like, who does your grocery shopping? Do you do your grocery shopping? Do you walk around the store? Do you have to get a wheelchair? Do you do your own housework? How much housework do you do? Gardening, and assess the level of activity. Another important part of the history is to also compare present to past times. So we're coming up on Christmas now. You can say, okay, what are you doing now? And then you say, well, Thanksgiving last year, what were you doing? Did you cook? Did you buy groceries? Did you spend time with your family? Things like that, because sometimes patients don't realize how much of a decline that they've had until they compare those two time periods. And it's important to note that when patients do not have symptoms, the chance of sudden cardiac death is less than 1%. In those patients that develop symptoms, the risk goes up to over 30%. So it's really important for clinicians to appropriately assess the patient and diagnose aortic stenosis early.
Thanks so much, Chloe. Those are very helpful tips that I think we'll all remember. And thank you for your time and your expertise in helping to lay the foundation for understanding the healthy and the unhealthy aortic valve. To our viewers, thanks so much for your time, and please tune in for the next video in this series, which will be increasing awareness and early identification of aortic stenosis. Thanks.
Thank you.